Professor Kunlin, please.
Thank you for invitation. After several years of clinical, practice, I realized that, the people die not just purely aging. People die because aging related disease, like cancer, cardiovascular disease, stroke, and AD. So we are not just want to stay longer, we want to stay healthy. This is why my talk is not just focus on aging, but also focus on the aging-related disease. As early in the 18th century, the life expectancy roughly is 37. In the early the United States, the life expectancy roughly 47. Now in 2022, roughly lifespan in the United States is 77 and 78. The currently, the longest, the life expectancy in the global roughly mostly is Hong Kong is 84.5. I think last year, ICCI I went to Hong Kong, they say 87 now. Then the Japan, Singapore, and Australia. So you feel that it's most of those countries near the ocean. Actually, it's maybe not the link to the seafood. For example, in Hong Kong, the people living longer because the health insurance, medication, mostly advanced medical equipment and medical, the drug like medication. So people can, as long as have the early sign of the disease, they can get the treatment. So the lot of the debate regarding why we get in aging. So one of a lot of theories like a program theory and free radical theory and DNA damage theory. So none of them can explain, the well to why we getting aging. So I think that one of the major, the theory is microcirculation impairment. This is the many cause of the aging. The main function of the microcirculation is deliver the oxygen and the nutrition and remove some toxicity and also the CO2 from our body. Once we microcirculation impairment or dysfunction over the time can result in accumulation of the toxicity products and the CO2 in our body and the loss of the nutrition supplement and oxygen in our corresponding tissue eventually affect normal, the organ function or cell function leading to the aging. So what's the evidence, The first evidence, the aging related with the capillary loss. So this is the brain of the animal is young rats and aging rats. As you can see that in the cortical view, a lot of the blood cell, particularly in the capillary, in the cortex, but when getting older, the number of the capillary is significantly reduced. We not just reduce the number of the capillary, but also when we're getting older, the wall of the capillary or the artery is getting thick. So this is getting thick. So sometimes it's the blood cell or immune cell sometimes is difficult to diffuse in and out from the organ. So the vascular loss is a primary hallmark of the aging. This is the immunostaining, use the full color of the staining, indicating that spleen, kidney, there is a loss of the number of the capillary. This is the immunostain indicating that in the human section and also in the animal section, kidney, muscle, and the spleen, indicating the number of the blood vessel, particularly like a capillary and the city, and small artery, you can label the alpha small muscle unit. is we can see that the number of the capillary cell, like endothelial cell, is significantly reduced when we get in older. Another concern is that evidence is the oxygen delivered to our brain, to our body, is reduced with increased aging. This function MRI indicating that oxygen is reduced when we get in older. This cartoon showing that compared to 20 years old and 80 years old, the cerebral blood flow is reduced with increased aging. Is green matter? And the artery changes at time in the blood vessel. Also, the cerebral blood flow is reduced and ATTs increase when getting older. One of the mystery, the stuff is that the longevity in the Salento is the South Sea Island in the Italy. The average life expectancy in the Salento is right at 92 years old for women and 85 for men. In 2016, Dr. Salvatore, did some study. They have found that the blood flow in their muscle is much the stronger compared the other city. They have found that so they're in the serum or in the blood, there's one protein called BDIFB4. There, when isolate this protein injection to the animal, they increased the blood function and increase the microcirculation. This further confirmed the microcirculation is critical for our aging process. So the microcirculation dysfunction, I think is the key is linked to the other aging theory, like stem cell theory, because if you don't have the blood supply, don't have the nice environment or niche for the stem cell proliferation, migration, and the differentiation. Like a free radical, if we don't have enough blood supply, the free radical of course increase there. Same as the DM same theory and the program theory is kind of key link there. So we know that the capillary may contain the endothelial cell. Now we found that not just endothelial cell, we have also another cell called a pericyte. Pericyte is also looked on the capillary. This is the EM study. This is the indicating the pericyte. The beauty is the pericyte not like endothelial cell. The pericyte have some construction function because they contain small alpha muscle cell, the protein. So it can directly control the blood flow in the capillary. This is the evidence indicating that, there's pericyte construction. So this is the X-wave study. In the middle is a red blood cell that can pass the blood cell. When get it stimulated, pericyte can construction. So it's leading to the diameter of the capillary getting smaller. So blood cell cannot pass the capillary. The pericyte also, regulated by the glutamate and other hormone. So when we're getting older, so the pericyte will be consistently, contraction. So leading even we see the blood flow in the main artery or main vein, but in some bed of the capillary, because the construction of the pericyte. So this area don't have the blood supply. With increased aging, the number of the pericyte also decrease. There's the immunohistochemistry indicating the loss of the pericyte in aging the animal, the kidney, muscle, spleen, and the thermus. This is published in Science Advance in 2021. if, parasite depletion also induces vascular regression in the region of the spinal ganglia, neuron, and in the adult mouse. See, compare these slides indicating without the parasite, depletion of the parasite depletion, you see the number of the blood, the capillary also is reduced. There's control, there's parasite depletion. That's indicating that the number of the capillary also is reduced. That's probably in the 2003 e-life. Transmission bring capillary perfusion and a change in cerebral blood flow in the parasite deficiency animal, the mouse. Is this the white animal mouse? This is the heterozygote, and this is the homozygote. When parasite completely depletion, the perfusion or cerebral blood flow also significantly reduced. This is one of the possibility is the number of the capillaries also reduced. So parasite not just involve the aging, but also involve the aging related disease. This is the example. Parasite dysfunction may trigger the impaired microcirculation in the Alzheimer's disease. So this is the cartoon indicating the non-A beta deposit. With A beta treatment, the diameter of the capillary is significantly reduced. This is the left panel indicating immunostain. So we can use the mark like a BDGFR beta indicating the marker of the parasite. So on the right bottom indicating that with add A beta, without A beta, the diameter of the capillary is significantly reduced. That's an X-ray study, indicating that it's a parasite truly in a contribution to microcirculation in the AD brain. This is a summary, indicating that the parasite function in healthy brain, in AD brain. So parasite is not just involved like the blood flow, also involved because this is the part of the vascular units. So it also, it's the BBB, the function also is critical. This is an example, not just like AD, but also involve the ischemia stroke. This is the non-ischemia brain, the blood capillary like this, of the ischemia brain because of the parasite contraction. So this blood flow cannot pass through. This is like you can red arrow indicating that it's discontinued. DRC imaging. This is the blood, the dots indicating red blood cell and of the ischemia because of parasite contraction. So some blood cell cannot pass through the capillary. We are in the clinical setting, there's some ischemia stroke. We can treatment by the TPA. The TPA is enzyme can dissolve the clot, right? So even in the some patient of the ischemia stroke, even after the treatment with the TPA, the motor function still recovering. So there's a hypothesis that even the main artery is perfused because, however, the parasite in the capillary still consistently, the contraction, leading the low perfusion, and motor dysfunction. So how can we improve the microcirculation? Improve the healthy and still the longer and still healthy. So some of the exercise, the people study that this also published last year that if you do some exercise, also revised aging-induced deep dependent decline in the cerebral microcirculation. So young age and aging with exercise. If you do more exercise, it will be increasing microcirculation and improve your healthy. This is another, the cartoon indicating that we do some exercise and also the the model, the cognition function also significantly improved. And also HBO. So the hypoxia and high baroque oxygen chamber. So the people can sit in there. So for a certain time, maybe like 1 hour or 45 minutes later, so they did that. Okay, so the telomere length of the T cell and also this is significantly increased by over 20% compared to control. T helper cell, the significant decrease in the number of the senescent cell of the T helper cell also is reduced. So that means the oxygen is critical for our aging, and the micro circulation dysfunction is maybe the leading of our aging.
Thank you very much, Professor Jin, for this very interesting and detailed presentation. Any questions, please?
You have mentioned behavioral, so to say, maintenance therapy by aerobic exercises, but we know that in cardiological diseases, various vascular growth factors are sometimes used after strokes or heart attacks to renew vascular genesis and angiogenesis, although these processes are dangerous to tumors. Are you proposing some controlling factors, endocrinological factors, or biofactors that could maintain slower degradation of microcapillary system? Thank you.
It's a very good question. So actually in the clinical setting, even like I have the cardiovascular disease or stroke at the acute phase, like first couple of days, we are not a recommendation for any doing exercise. But however, after the subacute phase, so we suggestions that we do some exercise. There are two types of exercise. One is active, one is passive. If patient still on the bed, is not able to do some exercise, the nurse or other nurse assistant can help do some the rehabilitation, for the move the leg slowly, gently. It's gradually increase the intensity of the exercise. Particularly for the stroke and the cardiovascular, disease, the cardiac, circulation is very critical. So most time, like heart attack or stroke, because the blood vessel have been occluded. So it's difficult getting reperfused, as this area is damaged there. But if you increase cardiac adjacent circulation, also increase angiogenesis, those is well documented that the exercise will be increase the angiogenesis and so cardiac circulation. Particularly it's like the VEGF, when you do some exercise, the VEGF is increased. VEGF is not critical for the angiogenesis. We study indicating that a lot of the neuron and other type of cell also expressing the VEGF receptor. So they are not just increase the angiogenesis and also have some the neuroprotection effect. So the kind of the combination the therapy mechanism.
Hi, thank you very much for this wonderful lecture. I'm also working on capillary dysfunction in aging, and it's really nice to hear you. And I wanted to ask you if you think that the pericyte dysfunction begins with endothelial cell dysfunction that disrupt the signal between endothelial cells and pericytes, or it is the other way around?
It's a very good question. Actually, we don't know. This is a very good area to study that, but which is leading cause and but for some study they that in a published in the Science, I think a couple years ago, when we get in the stroke, the parasite will be detached to capillary, so they move away. But those cells maybe they're dead, the parasite may be dead, maybe they move to different region. Is some of the components for the neurogenesis, but we don't know. That's just a hypothesis.
Yeah, thank you.
Okay, the question is, you presented sickness of vasculatory visaging, but I think it is believed that with neurodegeneration there is leakness of blood vessels. So are both processes exist?
So yes, the BBB, is damaged. When BBB getting damaged, they are leakage, particularly for we call it dysfunction. So sometimes, the wall getting sick, maybe like the not just a cell, they're getting the number is increased. Actually, it's not. So getting sick is wall getting sick. It's there's some the deposit of the fiber and also the lipid, and there will be increase. So the tight junction sometimes is not so tight. So that's why when you do the blood test, you can find some even like a neuron cell, H cell in the principal blood cell in the AD patient. So because there's some cell can leaking from brain through the blocking the BBB to our body. So microRNA diagnosis is also protein marker is for the diagnosis of the AD or PD or the Huntington's disease because BBB is leaking. They both exist.
Thank you very much, Professor Jin.